Kia ora koutou. This morning I have formally tendered my resignation as Minister of Health, which has been accepted by the Prime Minister. Serving as Minister of Health has been an absolute privilege, particularly through these extraordinary last few months. It's no secret that health is a challenging portfolio. I have given it my all. But it has become increasingly clear to me that my continuation in the role is distracting from the government's overall response to COVID-19 and the global pandemic. You will recall that I offered my resignation during the Level 4 lockdown in response to mistakes I made in a personal capacity. The Prime Minister made it clear at the time that under normal circumstances she would have accepted that resignation, but she did not want significant disruption to the health system in the middle of an emergency response. I've always taken the view that the team must come first, and New Zealand's COVID response is simply too important in my view. So I've made the call that it is best for me to stand aside. We've now shifted to a more stable footing with no evidence of community transmission. With the focus shifting to containing the virus at the border, it is appropriate for me to move on. I could not be more impressed with how New Zealanders and our health system have responded to COVID-19. The response from health workers at the front line has been astonishing. And I want to take this opportunity to thank the medical, nursing and allied health workers who have kept us all safe by putting themselves in front at the front line. Alongside the sacrifices made by ordinary New Zealanders, the combined efforts of our health workforce have put us in a position that is the envy of the world. And I think the results do speak for themselves. In global terms, our low hospitalisation and mortality rate is a testament to the strength of our health system and its workers. Despite more than 80,000 tests in the last 2 weeks alone, we have no evidence of community transmission. The only cases we are identifying are at our borders. That is how the system is supposed to work. Because it has worked, we're now on a more stable footing. New Zealand's health system continues to build capacity to keep the virus at bay. Now is the right time to hand over the reins and move forward with new leadership. It's been a privilege to serve in this role and lead that work, and to lead the work to rebuild our public health system in particular. We've made record investments in funding for DHBs, record investments in capital spending to rebuild our rundown hospitals and health facilities. We've made doctors' visits cheaper for over 500,000 New Zealanders. We've made doctors' visits free for under 14s. We've made historic investments in our mental health services, including sorting pay for our mental health support workers. We've hired more than 2,000 more nurses and increased their pay. We've established the Cancer Control Agency, Te Ahu o Te Kahu. In managing the system, there are huge challenges, and these other things on top of those day-to-day challenges are significant achievements. It's been a busy but rewarding 3 years, and I leave the role proud of all we've achieved in that time. But it has not all been plain sailing, and I wish to put on record again that I take full responsibility for the decisions made and taken during my time as Minister of Health. Although ministers are generally advised against being publicly effusive about public servants, I want to put on record again that it has been an honour to work alongside the Director General of Health, Dr. Ashley Bloomfield. He is an exceptional public servant. Thank you, Ashley, and your team for the extraordinary work you have done for our country during our most serious health crisis in a century. The time is right to hand over to another minister to drive forward the changes proposed in the Health and Disability System Review, so ably led by Heather Simpson. It's my sincere hope that a re-elected Labour-led government will drive forward that agenda and that we continue to build a health service that is available and accessible to all New Zealanders, no matter who they are, no matter where they are, and no matter how deep their pockets. Before I take your questions, let me answer one of them in advance. With this decision comes the freedom to spend more time serving as a constituent MP. I remain committed to the Labour Party and to my electorate. So come the general election in September, I will be asking the people of Dunedin for their continued support to serve them as their local MP.
When you threw him under the bus, standing right beside him, when you watched that video, what went through your head?
Look, I've been really clear all along, and I think the important thing is the whole context of my admiration for his work. I continue to think Ashley Bloomfield is an exceptional public servant. I've frequently said that. I've said it again today, and I'm grateful for the work that he and his team have done as we've put ourselves in a position that is the envy of the world. I want that work to continue. We've been in a really unusual and extraordinary circumstance. New Zealand and our team of 5 million have done an extraordinary job. I want to make sure that we're on a stable platform going forward. I don't want to be a distraction from that response. I want to put the team first.